What should you know about stopping birth control if you want to get pregnant? Hi, friends. I'm Dr. Natalie Crawford, a board certified OBGYN and REI, so I'm a fertility doctor. And this channel exists so that you can learn more about your fertility and hormones and health and be a better advocate for your own body. And a question I get asked all the time is about birth control, specifically stopping contraception before you want to conceive and what you should know and do. Before I dive in, I just want to say thank you so much for being here. Please consider liking, subscribing, commenting, and sharing. And more information can be found in my new book, The Fertility Formula. You can buy that anywhere books are sold. So, when it comes to birth control, we have to really divide it down into the different categories of birth control. And that can be the birth control pill, can be both hormonal and non hormonal IUDs. And then we also have patches, rings, we have injections, and implants. So, there's a lot of different types of birth control that we can talk about. Most often, we're talking about the birth control pill. The birth control pill is directly impacting ovulation. So, if you have a group of eggs coming out of the vault in the ovary, each egg grows inside a follicle. The brain is going to send out FSH or follicle stimulating hormone, which is well named, and it gets a follicle to grow. As that follicle grows, the egg is maturing and it makes estrogen. And when estrogen's high enough, the brain will send out a surge of LH, luteinizing hormone, allowing the follicle to rupture, egg to be released, and that is ovulation. So, birth control pills bind to estrogen receptors in the brain. It's a different type of estrogen called ethinyl estradiol. And what that does is essentially prevents the release of FSH. So, no FSH, no follicles grow, you don't ovulate. Importantly, this does not change the rate of loss of eggs. Eggs come out of that vault every single month before you're born, before you start puberty, when you're on birth control, when you're pregnant, when you're postpartum, until the vault is empty. So, no change to the loss of eggs. So, the idea that the birth control pill is going to harm your fertility by harming your egg count is false. Caveat: birth control pills, the longer you use them, and specifically if you aren't taking a break to have those placebo pills or have a bleed, now we have contraceptive pills where you can go every 3 months before a bleed or even just continuous use. And this might be great for symptomatic reasons, specifically if you have heavy periods, bad pain, endometriosis, PMDD, but that is suppressing the ovaries to a degree that it also suppresses the production of AMH or anti-Mullerian hormone. AMH is a marker of your egg count. So if I draw an AMH in somebody who's on the birth control pill, it might be as much as 30% lower than it really is, meaning you have the eggs, they just can't make AMH. This falsely gives the narrative that it's decreasing your egg count, which it's not. It's just overly suppressing. Side note, I still draw AMH if you're on the pill and you like being on the pill. But if it is low, then we want to do a further evaluation and talk about should we come off the pill for a couple months and get the real answer. That will depend on your personal scenario. The birth control pill does prevent ovulation. So, one of the biggest faults is that we don't know if you are ovulating or not when you're taking it. And many people are given the pill for an ovulation disorder like PCOS. So, when you stop the pill, the underlying brain ovary communication has to come back to light. So, if you have PCOS, polycystic ovarian syndrome, if you have hypothalamic amenorrhea or dysfunction, if you have thyroid disease, these things will come to light. So the pill is taking away the ability to track your cycle. That's why I recommend that you stop it about 3 to 6 months before you want to get pregnant so you can learn to track your cycle. Now, what are studies telling us? Studies tell us that no form of contraception has higher rates of infertility. Remember that infertility is defined as not being able to get pregnant at 1 year. But that doesn't mean that there might not be some level of subfertility. So, a big study was done looking at rates of getting pregnant after stopping different types of contraception and comparing that to people who use no contraception. So, we'll say that your return to fertility is when the odds of getting pregnant are the same as they were in the group that did not use contraception. And there was a large prospective cohort following patients into the future, cumulatively had over 17,000 women in it, so a very high powered study. Looking at this with the birth control pill, it took 3 cycles to return to fertility, meaning slightly lower chance of getting pregnant those first 3 months than if you'd been on no contraception. By 1 year, rates totally the same. And honestly, back by month 4, it was back to normal. So stopping the pill 3 to 6 months before you want to get pregnant is something to think about. When it came to the IUD, we have to remember there's different types of IUDs. There's both copper and there's progesterone IUD. Importantly, in this study that I'm talking about, the data was collected from 2007 to 2019. And originally, the progesterone IUD was higher dose and only given to women who'd had a baby before because it was larger. This has now changed, and now we do have smaller, lower dose progesterone IUDs that can go in what we call nulliparous patients or people who've not had a baby before. But in this study, the copper IUD had about a 2 month return to fertility because of some of the associated inflammation changes. Remember that the copper IUD doesn't change ovulation at all and doesn't actually change the lining. It causes inflammation inside the uterus, so sperm and egg cannot meet and an embryo cannot implant. A progesterone IUD, on the other hand, works differently. It can change the cervical mucus, it changes the endometrial lining and the receptivity. At the onset, it can prevent ovulation, but not always. And some studies have shown that you might have decrease in the receptivity or a change in the estrogen to progesterone receptor expression in the first 6 months after a progesterone IUD is removed. Like having a birth control pill, you lose the sign for ovulation when you have a progesterone IUD most of the time. Now, with a copper IUD, you're still ovulating, still having a regular period. A progesterone IUD, you actually thin the lining so much that many women will have a thinner lining when they stop. And if you have amenorrhea or no periods, we don't know when you're ovulating at all. So I usually recommend removing a progesterone IUD 6 months before you want to be pregnant. Of course, this means you need to have good, reliable methods of contraception otherwise. And I have to say, in all of this, whether it's the birth control pill, the patch, the ring, the injection, the IUD, you can theoretically get pregnant the moment you stop the contraceptive. So it's not preventing pregnancy. That's what the contraceptive dose is for, but it might be contributing to some subfertility. So for a couple months, we see that the copper IUD can impact your fertility. The progesterone IUD, the data is less clear, but we're concerned it could be theoretically longer. The most concerning data in this prospective cohort was the injection, which you know is my least favorite if you've been here. Depo-Provera is a progesterone injection of a very high dose progestin that does prevent ovulation. So the IUD, low dose, doesn't prevent ovulation. The progesterone injection does. It is proven to be a contraceptive for 3 months, but a single injection can prevent ovulation for up to 18 months. And in our study, looking at return to fertility, it had the longest return to fertility of 5 to 8 cycles before the group who'd had an injection had the same rate of getting pregnant as the group who had not. So a much longer time. Again, I don't recommend that if you would like to be pregnant in the next 18 months. So that should be one that we stop well before our pregnancy. And then the patch or the ring, those look closer to the birth control pill, be it at 3 to 4 cycles. So we should stop that in line with what we would the pill. And when we're stopping, the next thing we want to learn to do is to track our cycle and not just when cycle day one is coming, but how to track ovulation because we know cycles where you time intercourse to ovulation have the highest odds of helping you get pregnant. So this can mean cervical mucus monitoring, basal body temperature, or using urinary based hormones like an ovulation predictor kit. Targeting intercourse based on those is going to have the highest rate of success. I detail these more in other videos, but very quickly, using any of these methods will help you get pregnant faster. There's not one that's superior to the other, and you don't have to use all three. So you have the flexibility to try what is going to be the most successful for you. But the most important thing is to think through what your timeline is going to be in the perfect world so that you can stop your contraceptive and learn to track your ovulation and give yourself the highest odds of getting pregnant. I know you're going to have a lot more birth control questions when it comes to birth control to fertility. Ask them below, and I'm happy to answer them. As always, you can get more information on Instagram at Natalie Crawford MD and check out the fertility formula. Thanks, friends.